let me just get set up here. If you guys can hear me, kindly join me in the comment section and let me know if you guys can hear me. We are streaming live in multiple platforms today. So let me just set up my screen real quick. Good morning. Someone's joining me today from YouTube, Fernanda. All right, so let me just set up this screen real quick and share my link of the live stream to my page as well. But anyway, name guys is Dr. Nurse Paul. That's my social media name, and I am on Instagram, Facebook, and also in TikTok. I do NCLEX classes through aspirern.com, a company that I founded that is based here in Houston, Texas. And it's 8 a.m. here in Houston, Texas. So good morning, everyone. All right. Thank you. Halima could hear me in Facebook. Thank you. Hello, Leah. Thank you. Joining us from Saudi. All righty. So one second. Let me just share this pretty quickly. Um, I run out of time today because I had to take care of something this morning, and I was scrambling a little bit to get to this live stream. All right, I was live stream last night too. Can you guys tell me where you guys are joining from? All right. Anyway, for those who have not followed me yet, my social media name is right here. It's Dr. Nurse Paul. All right. And I'm currently a nurse practitioner here in the US, urgent care nurse practitioner. I used to be an ER nurse. And aside from that, I teach NCLEX as well. We've helped nurses from over 45 countries pass the NCLEX through my program, aspirern.com. We're going to talk about that in a little bit. All right. Let me just share this pretty quickly. And today we're gonna have a case study. All right, we're gonna have a case study today. Thank you, our moderator, for flashing the location of our viewers. Today we have Shireen from Riyadh. Tim Billy is joining us from South Africa. Joanne is from Riyadh. Halima is from Kenya. Katie is from New Zealand. Akil is from Philippines. Nasus is from Oman. So we're all over the world today, right? That is good. All right. So we are streaming simultaneously in my page in Facebook, Dr. Nurse Paul, and YouTube. We're also streaming live in AMN International, Facebook, LinkedIn, YouTube, and what's the other site? YouTube. Yeah, I think I've said that already. And of course, this show is a free class hosted by Aspire RN and AMN Academy. As you know, guys, AMN International is one of the biggest recruiters for nurses all around the world. And we've partnered with them with their scholarship program for nurses who wants to come over here to the US. So let me just get set up. We're still waiting for more viewers. All right. And if you guys can help me share this. All right, we're gonna start with a case study today. All right, and I haven't been doing this class for a little bit. Right, Randall is joining us from Singapore. Lilibeth is joining us from the Philippines. All right, that is good. All right, let me just share this to my groups right now. That way, our students can also follow me. All right, through this live stream. I want to be able to share this to as many people as I can today because we're doing free class. All right. So for those who do not know me again, let me just introduce myself quickly. Name is Dr. Nurse Paul. You can call me Paul or DNP. I probably prefer DNP. That's my social media name. I have a doctorate degree in nursing here in the States, or DNP is what my doctorate degree is. I'm also currently working as an urgent care nurse practitioner here in the US. I'm an immigrant nurse, just like a lot of you guys that are watching us today. I've been here in the States for 7 years. I'm already an American citizen and living the American dream. All right. I also went through retrogression, guys, before coming here to the US. I waited for almost 10 years, 9+ years from being hired in 2008 to getting my priority date in 2009 to getting abandoned in 2014 and finally coming over here to the US at 27. I started my NCLEX process at 20. I got here in the States at 30 years old. So you can tell, right, that even though with the retrogression, I can honestly say to you guys that the American dream is real. So for those of you who are undergoing retrogression right now, and for those who do not know what is retrogression is there is a limit to the visa that US can give to us immigrant nurses. All right, there's a limit yearly. And right now we're severely backlogged, not severely, but we're about 2 to 4 years backlog, which means they're still processing visas from 2021, 2022, 2023, or prior to that, right? So if you're applying now for the NCLEX and you pass your NCLEX this year or next year, you might have to wait another 3 to 5 years. But guys, let me tell you this: the wait is worth it. All right, now I'm living the American dream. I grew up very poor, guys. For those who do not know me, I share this in social media. You know, when I was studying nursing in the Philippines, I was studying under a candle because we didn't have electricity. So for now to be able to serve the community, but also be a breadwinner for my family, share my blessing for my family, share my blessing to you guys who are following me in social media and are always watching my reels about NCLEX, about classes that I do. That is my way to pay it forward to the community, right? Because if anything, nursing has blessed me with so much. So we're doing this live, all right, and free with AMN Academy. That's my short introduction about myself. But more importantly, guys, I've been an NCLEX instructor for more than 16 years, almost 17 years already. And I actually created my program, all right? It is called um, it is called Aspire RN. I have my logo there at the bottom of the screen of what I'm showing right now. You can visit me aspirern.com. All right. Thank you, Yelish. Yelish said you're an inspiration. Hi, Sir Irvin. Irvin is the owner of Niners. He's one of our instructors for AMN Academy. And of course, thank you, AMN Academy, for the partnership, for bringing me into your platform, and also being able to share this to my platform at the same time to teach our nurses all around the world free NCLEX. It is my honor to be in front of you guys today. And for those who do not know me yet, you can follow me on social media. I share a lot of stuff about NCLEX. All right. And all right, where everybody coming from? Jenilyn from Saudi Arabia. Nice. Irvin is from Pasay, from Philippines. We miss you, Irvin. Hopefully, Irvin, next time collaboration. Let's do a collab show. All right. Irvin is the owner of Niners, one of the best review centers or review agency or prep agency for English exams. And as you guys all know, all of us immigrant nurses, unless you're a British or a Canadian or Australian, we need to take an English exam before coming over here to the US. And for those of you guys who did not know, all right, before I come over here to the US, I also had to take my English exam back in 2016. And I did it with Niners, with Irvin. So as I do my class today, Irvin is scoring my speaking skills. Let's see if I will pass the English exam today. I'm just kidding. How is everyone doing? All right. Guys, do me a favor before we can start. Are you guys able to share this to your friends or to your page right now? Right. So we can reach more nurses. I want to be able to be able to do a class with a big group of nurses today. All right. Last time I did this was about 2 or 3 months ago. I couldn't do it in the last 2 months. We had about 300 to 400 live viewers at that time. In my page right now, there are about 100 viewers already. Thank you. Winnie, I want to flash this in the screen. Winnie is one of our AMN scholars. All right. And she recently passed the NCLEX. Winnie, thank you for trusting Aspire RN. And thank you for following the study plan and recommendations we gave to you. Winnie is one of our AMN nurses and one of our scholars from AMN. I was in your program and passed in May. You are a true inspiration. Thank you for the work that you do. It is my pleasure, Winnie. I am actually honored that you are here to share your story. All right, and so many success stories follow us in Aspire RN. We are in Facebook, YouTube, and Instagram. Actually, Facebook, LinkedIn, and Instagram. All right. Neritis is watching us from Australia. All right. For those nurses who are practicing or wants to practice in Australia, good news for you. All right. NCLEX is also needed now for Australia. If you're an international nurse and you want to work in Australia, they are requiring for you to pass the NCLEX now. Before you have to do a bridging program, but now they require you to take NCLEX first, right? So, guys, for all of you who want to take and pass the NCLEX, the advantage is once you pass the NCLEX, you can endorse that NCLEX to not only US but also Canada and Australia. All right. And another thing, once you pass the NCLEX, you can also endorse that to UAE, United Arab Emirates. If you want to practice there, you are exempted from taking NCLEX. That's at least what I know. Please confirm to me if not. You are exempted from taking HOD, which is the licensure exam in UAE, United Arab Emirates, Abu Dhabi, and Dubai, once you're an NCLEX passer. So, really, once you pass the NCLEX, you open a lot of doors for you. All right. Now, question. Hello, Rolando, joining us from YouTube. Fernanda is joining us from Brazil. Who is ready to pass the NCLEX? Can anyone who wants to pass the NCLEX say, yes, I can? Let's start the day with positivity. I'm big in law of attraction, all right? Say, yes, I can. If I ask you guys, are you going to pass the NCLEX? Yes, I can. Are you going to leave the life of your dreams? You say, yes, I can. Hi, Shai. She was my student before in Philippines. I used to teach there as well. So, guys, it's a journey. All right, NCLEX is not easy. If it was easy, there is no need for me. All right, but for 16 years, I thrived on mentoring nurses past the NCLEX because NCLEX is honestly challenging. Thank you so much for everybody who's saying yes, I can. We have a good turnout today. Very good. So, guys, apologies for today, okay? Because I was, like I said, I had something that I needed to do this morning. So I was rushing to get to my office to do this live stream. So I was not able to set up the raffle. I was actually going to do a raffle. Unfortunately, I was not able to do the form to subscribe. So here's what I'm going to promise, all right? Within today, all right? I will do a raffle in my Facebook page. All right. After this class, follow me, Dr. Nurse Paul. All right. And for those who are following me, good job. After this class, I will post the link. All right, to where you guys are going to put your name, and I will announce tonight because it's morning here in the US, and I'm wearing my scrubs because after this I have to rush to the clinic. I still do clinics, like I said, I'm a nurse practitioner, but after this class, right, I will put up the raffle link, right, in my Facebook page. Is that okay? Because I'm not able to create the form. I have to create the form and you guys have to sign up there. I run out of time because I still have to set up my screens and my PowerPoints and all that. So my promise is we will still do the raffle, but it's going to be offline. That way I can focus all of my time to the end class. All right. So what you're going to do is follow me, Dr. Nurse Paul, right here. All right. In Facebook. I will post the link to the raffle right after this class. All right. Right after this class, I will post the link. All right. But make sure that you have joined this live class. So take a screenshot if you can, because I will verify that you've actually joined the live class. All right. And the terms of the raffle will be posted there. All right. So follow me, Dr. Nurse Paul. I will post the link today for the raffle. I will post the link today. And as a concession, because it's my fault, instead of one lucky winner, how about we do two lucky winners for today, right? After this class, I will post the raffle link, not today, not right now, after this class in my Facebook wall, all right? And then there will be, instead of one winner, how about we do two winners so I can help you guys pass the NCLEX? Can we do that? Two winners today. It's 8 a.m. today, so I will post the winner tonight at around 9 or 10 p.m. All right. We're going to use a wheel of names. I'm going to show the video if I was able to draw the winner. That way it's fair to everybody. But, and of course, all of my followers, this. Whenever I do live class, I always do raffle for my NCLEX scores. So there's a benefit of joining my page because you also can win my courses. All right. And we've already awarded more than 20 NCLEX courses just in the last 3 to 4 months when I started doing a lot of live Q&As in my page. All right. So there's a benefit with joining me because you will be able to join my raffle if you want to try my NCLEX course. All right. And okay, let's continue. Who is ready to take the quiz? All right. Next gen NCLEX case studies. There will be 6 questions. All right. Kindly zoom your screens because this will be a huge case study. So lots of stuff to read in a little bit. The fonts might be too little. So if you're using a small phone, it might be a little hard to read the case study in a little bit. But in the end, Clux case study is new. We just released it last year, April 1, 2023. It's actually one of my favorites. All right. Although there's a lot of stuff to read, all right, in the case studies because you have to read a case. It's like reading a chart of a patient, right? It's like you as a nurse coming into work, you're reading the patient's chart of someone who was admitted the day before or someone who just got admitted from the ER, right? But the good thing with that is I know not a lot of people like to read, but that's one of the things they score from you when you do your English exam to migrate here to the US. But guys, reading is key in case studies, right? The one thing that I like about case studies is all the clues are in the case. You know what I mean? The longer the case, the more clues there are for you to properly answer the question. So it may be a little hard, but to be honest with you guys, it's actually for me super easy as long as you have good grasp of the concepts or foundation in nursing topics or content, you will be able to answer that. So we're going to check your capacity or competency to answer a case study later. A case study is a 6-part case, all right? So there are 6 questions, and each question is geared to one competency and clinical judgment skills. What they're checking is your ability to judge patients clinically, just how you would do it in actual nursing. There are now 180 viewers in my Facebook page alone. That doesn't include AMN followers. Thank you, everyone. All right. Question one would be about recognizing cues, which means your assessment skills. Question two is always about analyzing cues, which means your differential diagnosis or nursing diagnosis, right? Or medical diagnosis. Question number three is about prioritizing hypothesis. So from the differentials, you now select one specific diagnosis of what you think is going on in the patient. And question number four is about generating solutions or planning in your nursing process. Question number five would be taking actions or implementation or intervention in your nursing process. And question number six is about evaluating outcomes or evaluation in your nursing process. So basically, this is just the nursing process, but it's fun actually because in the NCLEX case study is evolving, right? You're going to read more information as you read through the case. And again, it gives you more clues. And we're going to get a sample today, all right? So hang on in there. All right. I want your participation. All right. Are you guys ready to take the quiz? Guys, do me a favor. All right. Do me a favor right now before we start the quiz. Do me a huge favor. Are you able to click the share button at the bottom of your screen so we can share it to your pages? How about we do that? Can you guys click the share button, share it to your page or to your groups? All right, so we can reach out to your friends. Let's pay it forward to the community. All right, so we can share it to your friends. Thank you so much. We have a good turnout today. All right, and thank you to my followers as well for joining me in today's live Q&A. All right. And this live Q&A, the next gen NCLEX, is not only for nurses who wants to take the NCLEX. A lot of nurses that are already here in the States and the US are practicing as a nurse. They just want to refresh their knowledge. It's not bad to learn again, right? So that's it. A lot of nurses are also joining us today. Let's see. All right. And this is not a hard case. I would say this is a moderate difficulty case. Not too easy, but also not too hard. All right. So let's pay it forward to the community. At the bottom of your live screen, all right, click that arrow button, which means to share, all right? And thank you for everyone who's joining us today. Okay, let's now read your case study, all right? Again, case study number one is about recognizing cues. This question is not my original question. This is lifted from NCSBN, which is your National Council for State Boards of Nursing, which means they are the ones who created your NCLEX. All right, this is available in nclex.com. You can find it there. It's free, but I'm going to answer it for you. There's no answer, of course, in nclex.com. We'll answer this together. How about we do this? All right, I'm going to read it for you. Zoom your screens. Might be a little small, but this is how your NCLEX screen looks like. Same color. At the top, you'll see NCLEX RN, your name, all right, should reflect there during the actual NCLEX, all right? And of course, you're soon to be an RN here in the US. The nurse in the emergency department is caring for a 78-year-old female client. Client was brought to the ED by the client's adult child due to increased shortness of breath this morning. The adult child reports that the client has been running a fever for the past few days, has started to cough up greenish mucus, and complain of soreness throughout the body. All right. Start writing those pertinent findings, guys. All right. Get a piece of paper, start writing the pertinent findings because we need that until we finish the case. All right. We need those. Client was hospitalized for issues with atrial fibrillation 6 days ago. History of hypertension. Vital signs at this moment: 101.1 Fahrenheit. We use the Fahrenheit system in the US, or 38.4 Celsius. That's fever, guys. Pulse is 92. RR is 22. Blood pressure 152 over 86. Oxygen is 94%. 2 liters nasal cannula. On assessment, the client's breathing appears slightly labored and coarse. Crackles are noted in the bilateral lung bases. Skin slightly cool to touch and pale pink tone. Pulses are 3 plus and irregular. Capillary refill is 3 seconds. Client is alert and oriented to time, person, and place, or person, place, and time. The adult child states, sometimes it seems like my parent is confused. Peripheral venous access device is placed on the right forearm. Now, select for client findings that require immediate follow up. Look at the keyword. The keyword is requires immediate follow up. All right? Immediate follow up. You got it? So, guys, when I say immediate follow up, we're not talking about all the abnormal findings. I'm only talking about the most dangerous findings or priority findings. Remember, your goal here is recognizing cues or assess. What are your answers? Come on. I'll give you guys 30 seconds to give me your answers. Come on. This will be very interactive. Give me your answers. So here, this is like a form of what you call that? A SATA, all right? But it is not select all that apply. This is called select N, which is a type of next gen NCLEX question. Select N, which means it's gonna tell you how many numbers, how many answers you need to select based on the number. All right. So now I only need 4. There are 6 options. What are my priority? Go. Answer. Come on. Thank you to everyone who's joining. We have reached 200 viewers in my Facebook alone. All right. Thank you so much for everybody who's joining. Okay, I'm seeing answers now pop up in the screen. All right. How about AMN Academy viewers? I'm seeing people from my page putting their answers already. How about AMN Academy viewers? Let me go to AMN page and see how many viewers we have so far so we can see. All right. Or there are about 50 viewers in Facebook page alone, not including YouTube. I only have one device where I can check it. All right. Okay, I'm seeing answers from AMN followers as well. Very good. All right, I'm seeing answers come in. Very good. Ooh, lots of answers. Very good. Very good. Very good. All right. I need more answers. I need to be convinced to see more answers from you guys. All right. Okay. AMN people, come on. Join me and give me your answers. The people from my page are also joining. Oh, hold on, hold on, hold on. Paul Vincent. Paul Vincent. All right, let's flash this moderator. Just passed the NCLEX. Congratulations. I think you're one of my students in local boards as well, right? Congratulations, and he's with AMN. You're gonna be in good hands, Paul. All right, alrighty, alrighty. Okay, so many answers. Okay, how about we prioritize vital signs? Yes or no? I'm having a little issue with my screen too. It's not calibrated. How about we prioritize vital signs? Yes or no? Yes, yes. Vital signs, yes, because obviously you have sepsis-like symptoms, correct? I don't like that temperature. And if the pulse is above 90, that's already called sears, or which means you can have sepsis, right? How about lung sounds, guys? Lung sounds, we have labored course, crackles, all right? So that's a yes as well. How about capillary refill, which is 3 plus and irregular? Yes or no? Oh, is that our capillary fill? No, no, no. Actually, our capillary fill is 3 seconds. I think that's normal. Yes or no? That's normal. Correct? Capillary refill is normal. 2 to 3 seconds is your normal. Correct? So, guys, I'm not going to prioritize that. If it's more than three, I'll prioritize that. So, three is not the answer. How about client orientation? Sometimes my parent is confused, right? Sometimes my parent is confused. Yes or no? Yes? Yes? Yes. Okay. I'll click that because that shows confusion. I don't like confusion. If you're having sepsis like symptoms, if you have AFib, both of these can cause confusion, correct? How about radial pulse characteristic, which is 3 plus and irregular? Yes or no? Yes or no? Yes or no? Yes. I'll click that, right? How about characteristic of cough? Because greenish, we see greenish mucus, all right? Guys, let me tell you this. Greenish mucus doesn't always mean bacterial or pneumonia. It could also be viral, right? We don't know what it is based on the color of mucus. Before, when I was still a nursing student, we say if it's green, it's bacterial. If it's clear, it's viral. That is not true anymore, all right? You cannot judge what type of microorganism it is that's causing pneumonia or bronchitis based on the color of mucus. You got it? So we're not gonna prioritize cough because cough is cough. You know what I mean? It is not an urgent issue. Your urgent issue would always be about A, B, C, D: airway, breathing, circulation, and disability or LOC disturbance. You got it? You got it? Who got it correctly? 4 points. The good thing with NGN is we have partial scoring now. So you can have 4 points, 3 points, 2 points, or 1 point. Doesn't matter. Who got four? Who got three? Tell me your scores. How many points did you get? 4 points. Excellent. 3 points. Very good. 2 points. That's okay. 1 point. Better than zero. 0 point. Oh no. You need to enroll in my class. But this is a warm up question. You got it? You got it? Yes? All right, that's good. 4-3, very good, very good, nurses. This is easy question. All right, very good, awesome, awesome. Now let's go to all right the next screen. How do I get to that? Uh, uh, hold on. My screen had an error. There we go. Okay, so let me. Oh, okay, got it, got it. So I need to go here. All right, got it. Okay, let me take up. Okay, sorry guys. It's the first time I'm using a PowerPoint. All right. Second question. We are now in analyzing cues. All right. Analyzing cues. Same situation. Did you notice? There was no change to the situation. All right. But look at it right now. Look at it. It says for each client finding new question, same situation, but new question. Click to specify if the finding is consistent with the disease process of pneumonia, a urinary tract infection, or influenza. Each finding may support more than one disease. So, guys, this is what I call matrix grid, right? This type of question is called matrix or table. You got it? All right. And this is called what we call multiple response. In short, it's a SATA. All right. This is what I call in my class in my NGN class with my students a SATA on steroid. All right, SATA on steroid. You know what I mean? Because each column is a SATA. Like for example, guys, I need to answer pneumonia on first column, UTI for next column, influenza. I'm gonna choose the signs and symptoms, or sometimes it's management. All right. So guys, the point is you got to choose correctly per column. The problem here with the multiple responses is, hold on, it is right. Sorry about that. It is right minus wrong. For every incorrect answer, all right, you get a deduction. Be careful. You get a deduction for every incorrect check or mark that you click, all right? Be very careful. So my test taking strategy here, I'm going to teach it to you right now, is answer by column. So you answer it one by one. So you're focused. Instead of answering fever, is it pneumonia, UTI, or influenza, you're only focused on pneumonia. And then after that, you will focus on UTI. And then after that, you will focus on influenza. That way you only worry about one disease process at a time, right? You got it clearly. You got it clearly. One column at a time. All right. Let's go to pneumonia. What are the signs and symptoms for pneumonia? Remember, right minus wrong. Okay. Right minus wrong. What are your signs and symptoms for pneumonia? Everybody. Everybody. Pneumonia. Come on. What are your signs and symptoms for pneumonia? Help me out. Come on. All right. This is select all that apply. Fever, confusion, body soreness, cough and sputum, shortness of breath. All right. So we have fever, right? We have confusion, correct? Let's skip body soreness because that might be more viral. Body aches, right? Flu-like symptoms, cough and sputum, shortness of breath. So that's total of 4 points. If you guys check body soreness, you get a deduction, right? Compute your scores. Compute your scores. We're gonna total that. How about UTI? UTI, urine tract infection, commonly caused by E. coli, but sometimes it's also Klebsiella, Enterococcus, Proteus mirabilis, staph. One of the common things I treat in the office in the clinic. I do urgent care nurse practitioner, guys. It used to be ER. So if you want to be nurse practitioner in the future here in the States, follow me in social media too, because I share my journey there. All right. And soon I'm gonna launch my website too, and I'm gonna give out free ebooks for those who want to come to the US, free guides, how to start your American dream, free guides if you want to be a nurse practitioner. It's already on the works. It's gonna release this year. All right. So UTI, you still get fever. For 78-year-old, they can get confusion as well. Body soreness, cough and sputum, shortness of breath. Do we have body soreness? Are we gonna include that? They have flank pain, you know what I mean? They have CVA pain or back pain. They have pelvic pain, right? But when you say body soreness, I think it's too general, right? Like, do they have joint pains too? Do they have neck pain? Do they have shoulder pain? Do they have knee pain? Because that's body pain too. Like, that's more like myalgia, which is usually more viral illnesses, right? So body soreness is too general for me. But if it says pelvic, CVA pain, then I would choose that. You know what I mean? Because when you say body aches, are we also talking about knee pain? I don't think UTIs can cause knee pain, right? Because it's more in the bladder, more in the kidney, right? So we'll skip that for now because it's too general. So total points 2. All right? All right? How about the last one? Influenza. Influenza. So now this is more viral. Come on. This is my energy drink, guys, so I can wake up because it's only 8 a.m. here. And after this show, I have a class, my final coaching to my students who are taking NCLEX next month. And then I go to the clinic. Busy day. All right. What about fever? Yes or no? Come on. Fever. Yes. What else? Confusion. Yes. Right? What about body soreness? Yes, because flu-like symptoms, right? Cough and sputum, yes. Shortness of breath, also possible. All five of them, right? Because it's flu. Remember, flu can also lead to pneumonia, right? And flu is more like respiratory inflammatory response, right? So it can also move to the lungs. I think the answer are all of them. So total points, guys, the way you compute score is by column as well. So if here you get total 4. If you answer one box incorrectly, you get deduction. Here total score is 2. If you answer body soreness, for example, you get a deduction. And then here, obviously, there's no deduction because everything's the answer. What's your total score? Total score is about 11 points for this round. 11 points. All right. Remember the right minus wrong rule because this is a table or matrix. What's your total score? Everyone, there's so many participants right now in my page. Thank you so much. I appreciate you guys a lot. 10 points. Not bad. 8, not bad. You see what I like about next gen NCLEX, guys, is you can have partial scores. Agree? Agree, nurses? So for me, a score of 4, 5, 6, 7, and 8 is way better than 0. Agree? Agree? Because before, it's all or nothing kind of rule, which means in educators like me, all or nothing means you either get 1 point for this question or 0. You know what I mean? So that's only 50% chance per question. But here, because of partial score, you get more chances of getting high scores, right? You got it? Are you guys enjoying so far? Question number 3. Same situation. I don't know if you see it, guys, but same situation right here. All right. Same situation in the nurse's notes. But now we have a drop down button. All right. The client is at risk for developing what? Let's see if we can show the drop down. Okay. My screen is reacting. All right. All right, here you go. What do you think is our diagnosis? A stroke is at highest risk for developing what? A stroke, a hypoxia, a dysrhythmia, a pulmonary embolism. What's your answer? We're now at question number 3. Now you know the problem. It's more likely pneumonia slash influenza based on our SATA earlier or matrix grid. What do you think is that the patient is at highest risk for developing? Imagine if it's pneumonia, the lungs are inflamed. Imagine if it's influenza, the lungs are inflamed. What can you develop? This is an easy question. You guys got this. Only one answer. Only one answer. Come on. I need more answers. Come on. Uh huh. Stroke is less likely because we're focused on respiratory. All right. Pulmonary embolism is not the answer, guys. Because in pulmonary embolism, you don't develop fever. Plus, in pulmonary embolism, you gotta look for factors of where the clot came from. Sometimes it's caused, or most of the time, it's caused by DVT, but there are also other factors like are they clot producers? Are they on estrogen? Are they on testosterone? Are they heavy smoker with atherosclerosis diagnosed in the past, right? But without those things in the history, we cannot say it's pulmonary embolism, especially that pulmonary embolism doesn't really cause fever. When you see fever like that, 38.4, 101, suspect infection first, right? Especially you're more likely looking at the sepsis case here, right? So, guys, your choices between hypoxia and dysrhythmias, obviously, our answer is none other than, sorry about that, none other than hypoxia, correct? Correct, nurses? Hypoxia. Hypoxia. You got it? Because dysrhythmia is probably second priority. The question is, can the patient still develop dysrhythmia? The answer is yes. Why? Because the patient has history of AFib. But that's not the priority right now. The priority right now is the lungs are inflamed, the air, oxygen cannot move. All right. So our priority is airway. All right. Question number 4. Oops, there's a new information. There's a new information. There's a new information. Let's read that first, nurses. All right. So the new information is patient or nurse was called to bedside by the adult child who states the client isn't acting right. All right. Now the patient is difficult to arouse, pale and diaphoretic. You see that? Pulse is now 112, RR 32, blood pressure 90 over 62. Pulse is now 91. Getting better or getting worse, guys? Getting better or getting worse? Better or worse? Is the patient now developing sepsis signs? Yes or no? Yes or no? You guys developing sepsis signs? Yes or no? Yes. So therefore, what are your answers? Anyone? What are indicated? How about prepare the client for defibrillation? I or N? Indicated or not indicated? Come on, help me out. Come on. Not indicated right now. Guys, you don't need to defibrillate. Your patient still has pulse, right? Right? The patient still has pulse, right? Right there. All right. Place the client in semi-Fowler's position. Semi-Fowler's? Semi-Fowler's. Here's my question. Semi-Fowler's or high Fowler's? If the patient can breathe. Diaphoretic. Isn't acting right. Confused. Not indicated. So two things. If they're still awake, I'll put them in high Fowler's. Right? If they're unconscious, I'll put them flat so I can do my um whatever code procedures that I need to do. You know what I mean? If I need to do CPR, if I need to ambibag. So neither, not semi-Fowlers, all right? Because it could be either high Fowlers if they're awake or flat if they're unconscious. You know what I mean? How about request an order to increase oxygen flow rate? Do we need to increase oxygen flow rate? I'll check that. Definitely, we need that, right? I'm gonna start probably with increasing oxygen to max 6% nasal cannula. If it works, if it doesn't work, I'm gonna move up to non-rebreather, right? If not, I'm gonna start bagging the patient. How about request an order to insert additional peripheral VAD or VAD? Yes. How about request an order to administer IV fluids? Yes. Do we need to give IV fluids for septic patients? Yes. That's actually one of your priorities, right? IV fluids and antibiotics. All right. Total of 3 points. Who got 3 points here? Who got 3 points here? 3 points. Total of 3 points. All right. Total of 3 points. All right. Very good, nurses. All right. Okay, let's now go to your question number 5. Look at your case study. Did you notice a new tab? Look very closely. Did you notice a new tab? Yes or no? Yes. There's a new tab that says orders. So we're going to click that and see what it shows. All right. Order. So now in the order tab, the nurse notes. All right. Uh-oh. 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 All right. The nurse notes at 12:15 the doctor's order is insert indwelling cath, vancomycin 1 gram, computed tomography scan, sodium chloride bolus 500 ml, lab test, blood culture sensitivity, complete blood count, and arterial blood gases. What should you consider as a priority? Only answer one. All right. Usually in the NCLEX, this is a highlighting question, which means you're going to highlight the correct answer. But you're not going to highlight. You're just going to click to highlight. So these texts are usually clickable. If you hover your mouse during the NCLEX, I can't do that right now because obviously this is PowerPoint. If you hover your mouse, right, you are going to see that you can click those options. But what is your priority, guys? What is your priority? All of these are correct. We need this for sepsis. But guys, remember our priority is what? To start, how do I increase the blood pressure? It's now 90 over 62. How about we prioritize fluids first? Yes or no? We're going to click that whole thing, right? Yes or no? Is that correct, nurses? Yes? That's our priority number 1. All right? How about if I say second priority after fluids? What's your second priority? What's your second priority? That's not the question here. But if fluids are started, what comes next? Because it's sepsis, your second priority management, because this is now about intervention, is antibiotic, right? Antibiotic because it's sepsis. Agree, nurses? Antibiotics. Now, question, or ABX. Question, what lab test do you need to get first? And must ensure that you have it before antibiotic. Before you start antibiotic on a septic patient, you must Must what? You must collect what? Culture and sensitivity, correct? That's a rule, hard rule here for sepsis management. Culture before antibiotic. Why? If you do antibiotics without culture, you kill the bacteria. Yes or no? So the culture and sensitivity becomes um um what inaccurate, right? Because you probably have killed the bacteria that we're trying to kill. We need to know what it is because sometimes they have resistance. Good if if they're killed, or sometimes we need to tweak the antibiotic properly. All right, culture and sensitivity before antibiotic. But guys, because we're focusing on intervention, we do fluids and then antibiotic. All right, those are your interventions. All right. All right, now let's go to your last questions. Are you guys enjoying so far? Last question, number six. All right. Remember, number six is talking about evaluation of outcomes. So now we've stabilized the patient, same situation, same nurse's notes, same orders. For each assessment finding, click to specify if the finding indicates that the client condition has improved, not changed, or worsened. All right. So we have three options: improve, not change, or worsen. All right. Um, how the culture and sensitivity here for I don't know with the floor. I work in the ER, but I think we only do it once because once you start the antibiotic, um, I mean you don't get culture the following day. Or are you taking talking about turnover results? There's two results. The preliminary results come back within 24 hours. It will tell you if it's gram positive or gram negative bacteria. The final results is within 48 to 72 hours. All right. So it's very quick. The first 24 hours you'll get preliminary. It's gonna say gram negative bacteria, gram positive bacteria. That helps clinicians, providers, NPs, PAs, or doctors to tweak the antibiotic. So for example, it comes back positive for gram negative, but you're giving vancomycin. Vancomycin is more for gram positive. So we have to tweak it to more gram negative. Is it gentamicin? Are we gonna use um what's this? Your piperacillin? Something like that. All right, but two results. The first one is to detect if it's gram positive or negative first, and then the second one is the actual bacteria. All right, you got it. So two things, because we do PCR here too, so they can detect initially if this gram positive group or gram negative group, and that's important to tweak the antibiotic. All right. Anyway, let's now focus, guys. This question will focus on your last assessment, all right, which is actually your 12 o'clock assessment. So, guys, basing on your 12 o'clock assessment, the first one is pulse. What is your pulse? 112, right? 112. But here it's now, I'm sorry, the skin tone, here it's pale. And now your assessment is pale. So is that improved, not changed, or worsened? I'm sorry, my screen is not calibrated. It's not changed. Correct? Not changed. Agree? How about respiration? Respiration here, guys, is 32. 32. I'm sorry, my screen. Guys, it's 32, right? Now it's 36. What is that? Improved, not changed, or worsened? How about worsened? Correct? Correct, nurses? Yes. All right, very good. All right, how about blood pressure? Blood pressure, BP is 90 over 62 at 12. Now it's 118 over 68. Remember, we gave fluids already based on the previous case or previous situation. What is that? Improved, not changed, or worsened? This is improved. Very good. Very good, nurses. Follow me. All right, you guys still there? Pulse oximetry. All right. Pulse oximetry from 91% to 91% to 91%. What is that? What is that? Hello. Not change. Very good. Very good, right? It's very easy. So don't be scared with case studies. How about the last one? Where are my AMN students that are joining us from the live stream? Come on. Join me now. Client earlier was difficult to arouse, but now interacting with the adult child at the bedside. How about this is improved? Yes or no? Is that improved? Yes? Those are the answers. All right? Did you guys enjoy the case study? Because I did. I love case studies. And we do this in Aspire RN, okay? So for those who are interested, again, I just want to plug real quickly before I end. Thank you so much for joining. Aspire RN has helped nurses pass the NCLEX from over 45 countries and counting. Join the phenomenon. We are the largest NCLEX group in terms of footprints around the world. We have helped nurses from all over the world. All right. And I hope you guys enjoyed the way I present lessons. I do love to dissect questions. I also teach this is question and answer style. I also do in-depth lecture of pathophysiology, pharmacology, medical surgical nursing. Those are my forte, all right? I teach management of care and all that. Please join Aspire RN. We are next gen NCLEX ready. And once you join us, you have the Doctor Nurse Pulse guarantee that you will pass the NCLEX 100% through the Doctor Nurse Pulse method, aspirern.com. These are our program. All right. The full course is what I recommend for all of you guys. The crash course is only for those who are taking the NCLEX next month. And that's total of 16 weeks if you do it full time, but you have unlimited access for 1 year or until you pass the NCLEX, as long as you follow my study plan. You know, the good thing with us, guys, is you get assigned to your personal student advisor and personal mentor. All right. It's called personalized teaching. All right. I believe in that. A lot of review centers or programs you join, you're part of a group of 5,000, 1,000, 10,000, right? You don't even have a direct interaction with your instructors. It's hard to learn that way, all right? With me, it's more personalized, all right? There's more, you feel like somebody's really taking good care of you. And we take pride of that. A lot of our nurses are proud of us, right? Or say good things about us because we really take good care of them, all right? And if you're not happy with that, I'm gonna return your money, all right? If you're not happy with the program, of course. And for now, we're offering 30% off for Labor Day. Labor Day was actually 2 weeks ago, but for the entire month or until September 20, actually, in the screen, we still have 4 days. We are slashing it off to 30% off to $385 from $550. Ask my team, message my Facebook and Aspire RN's Facebook of how you can get this course slash the 30% off. We will give you the code once you talk to us, and we'll also teach you how to enroll in our program. But everything's available online, aspirern.com. You can see my program there and you can compare as well. You can follow us in Facebook and Instagram. You can see our passers as well there, right? And for everyone who wants to pass the NCLEX, say yes, I can. Somebody asked, do you do HESI prep? I don't do HESI prep just yet, all right? But I mean, HESI is also similar to NCLEX. It's just your exit exam from nursing here in the States. So maybe you can join my program, all right? And I'll tweak the program to you. Everybody who will pass the NCLEX and who wants to fulfill their American dream, all right? Say yes, I can. And don't forget, I will post the raffle link immediately after this class in my Facebook page. So if you join, take a screenshot right now. This will be your proof when I ask you for proof when you win that you've actually joined this live stream at this time. All right? Because you have to be participating in the live stream for you to win. All right? There will be two winners for today's class, but this will be in my Facebook page. The raffle link will be posted immediately, and the results will be posted in about 12 to 14 hours, which is tonight in US time. All right. Thank you, everyone, to those who joined. And yes, you can. I'll see you guys next month here in AMN Academy. Bye.